This is Walt Fritz from Foundations in Manual Therapy Seminars with my next in the series of manual therapy evidence for the speech pathologist. And in the case of this paper, I think it's manual therapy evidence for all of us. You know, historically, manual therapy has been always deemed to be this skilled intervention where the practitioner is the expert, identifies a local problem within the body, and then through skilled assessment, choice of technique, etc., locally remediates that problem. You know, the skill of me breaking up muscle spasm or manipulation to reduce tension historically was always the way that manual therapy was explained, whether it's outside the speech pathology literature, certainly within the speech pathology literature. But this particular paper is a 2019 paper by Nelson Roy and a team et al., where they were looking at the effects of muscle tension dysphonia on brain activation. Now, Nelson Roy is a bit of a hero for me when it comes to evolution of mindsets, evolution of presentation and thought. You know, if you look back on his first paper where he talked about using manipulation for muscle tension dysphonia, back Roy and Leeper in 1993, essentially, and I don't want to paraphrase too inaccurately, but it was about what happens in vagus stays in vagus perspective. There's too much muscle tension in the perilaryngeal musculature, and the clinician with skilled intervention comes in to manipulate that, to manipulate reposture, and then begin allowing the patient to speak with a reduction in that muscle tension and a repositioning of the larynx. You know, that was sort of the mirror of Arnold Aronson's original premise presented back in 1980 in Clinical Voice Disorders. But if you download and open up Nelson Roy's papers from 1993 to 2019, you're going to see a real brilliant evolution of thought. Evolution of thought from, well, okay, we used to think it's all about here, but we're seeing it's more about here instead, right? That possibly this is just the tip of the iceberg. We're using this as an input, a sensory input to the patient's nervous system to decide if change is warranted, in essence. And I think that's exactly what Nelson showed in this 2019 paper. There's another person I'm really fond of quoting in my classes as well as online, and that's Tommaso Geri et al. In a paper they did in 2019 called Manual Therapy Exploiting the Role of Human Touch. And he has just such a salient quote from this that I want to read. Clinicians should remember that manual techniques are not tools to fix the patient's body. Rather, they provide the opportunity to communicate with the patient's brain similar to words. And, you know, I see so much overlap between what Jerry is talking about in this 2019 paper, and Roy, in essence, is talking about in his 2019 paper. Now, Roy's paper had a lot more to it. They spoke of a lot more things in terms of brain activation, psychological, psychiatric issues, some various historic views of what muscle tension dysphonia was created and caused by, as well as the remediation of it. But to kind of sum up this paper in a nutshell for you, what they did was they took a patient with muscle tension dysphonia and they put her in an MRI machine and had her read a pre-written script. And what they were doing was, as she read that script, they were watching activation patterns of the brain. And what they witnessed was a very typical dysregulated brain activity. Now, if this is your thing, you could certainly go to this paper and see what parts of this person's brain were acting in a dysregulated fashion, what parts of the brain, what mechanisms, etc. Then they pulled her out of the machine. They did the equivalent of a session of circumlaryngeal treatment where they manipulate the larynx, they try and reduce the tone, they reposture the larynx and higher mechanism by pulling it downward, and then they had the patient begin to speak, which is the very typical protocol for circumlaryngeal treatment. And when the person can begin to start to create and hold a more normalized voice, then they release the pressure to see if they can hold that. Well, that's what they did in this case, except that after she had achieved a more normalized voice, they slid her back in the MRI and they had her read this script again. What was really interesting is the dramatic switch, the dramatic change, the evolution of that brain activation from dysregulated to regulated. Now, this does not prove that this person's problem was here and not here, but it certainly adds a lot of credence to the fact that this is a whole person, a nervous system issue, whether in this case, muscle tension dysphonia, or I believe in general, a lot of the issues that manual therapists, massage, myofascial release, you name it, what we think we're doing at the periphery, sure, we're doing something, but that's more a signal to the central nervous system, autonomic nervous system, to begin to create change on the behalf of the patient. So I really do hope you take some time to look at this study. How does it affect our practice? Well, the realization that manual therapy is much more than just this skilled intervention where we need to figure out exactly what to do to remediate this issue and come to the awareness that it's a form of communication, as Jerry talks about, to allow a person to feel, number one, is it safe? Number two, can we change? And number three, to maybe figure out strategies on how to create that change. I will attach the links to both of these papers right here in this article. And if you have any questions, let me know that the article is available for download. If you're a subscriber to my newsletter, you can subscribe at waltfritz.com, and the Insider's newsletter has a lot of links to a lot of really great research out there. Thanks for listening.